Today we're going to do a nasal and a throat swab. At this point, we have our patient sitting there very comfortable in the chair. We already greet them and check all the details and procedures. So now I'm going to proceed to explain the patient how is this procedure going to take place. Hello, good morning.
Hello.
Today your doctor indicated for you to have a nasal and a throat swab.
Okay.
All right. So this is the equipment needed for it. All right. So what you see here is I'm going to insert this little tube into your nose cavity.
Okay.
And tickle a bit around. All right. You might feel a bit uncomfortable and feel like it's sneezing, but I'll get a tissue there for you to have.
Okay.
And the throat swab, I'm just going to help myself with a tongue depressor here to press slightly your tongue down, and then proceed to tickle in your throat both sides with this tubing that you see in here.
Okay. Sounds fun.
So we perform hygiene. Gloves on. And our patient is sitting there comfortably. All right, so the first swab will be on the nose. I'm just going to keep my tissues nearby. So we open the package of the swab. Notice that there is two tubes in there, the swab and the tubing. The tubing comes with a lid on, so we'll take it off and leave it in our kidney dish. Then we ask our patient, can you please tilt your head for me and look up to the roof? Thank you very much. And then we have a look in the nose, and we insert the swab following the line of the nose into the cavity, and then we twist gently, take it off, and the same in the second nostril. Follow the line of the nose, twist around a bit, and take it off, and we put it straight into the tubing. Are you all right there?
I'm good, thank you.
Was a bit uncomfortable?
A little bit.
A little bit, yeah.
Yeah.
It tickles a bit. So we leave that tube in there. Dispose of the rubbish. And then we proceed to do the other test. We just quickly make a little note in here that this is the nasal swab. So it doesn't get mixed up with the other swab when you do it, because they look exactly the same. Now I'm going to proceed to do your throat swab. All right, so it's going to be about the same thing. The only difference is obviously you have to open your mouth now for me. There we go. So again, we remove the lid from the tubing. And then this time we will have to leave it in our kidney dish, waiting to be used, because we need both our hands to proceed with the throat swab. All right, so can you please again tilt your head for me? So if you can open your mouth for me and stick your tongue out. Thank you very much. Say ah.
Ah.
So we proceed to gently press the tongue depressor on top of the tongue, and then insert the swab into the throat on the sides only, gently touching one side and then the other side. We take it off. We dispose of our tongue depressor, and our swab goes straight back into the tubing. And again, we make a little writing on the tubing, making sure we write in the throat swab so they don't get mixed up. Dispose of our rubbish, and then we have our samples. We check that our patient is all right. Are you okay there?
I'm okay, thank you.
Was it any uncomfortable?
It was okay.
Sometimes our patient might feel like having like gogging there. It's a normal reflex as long as we don't touch too deep, just the sides of the throat. Thank you.